I'm Beverly Kirk, Director of the CSIS Ideas Lab, here with Gayle Smith, Special Assistant to the President and a Senior Director at the National Security Council, and we're talking about the Global Fund. Thank you for being here.
I'm delighted to be here.
First and foremost, why is the U.S. such a strong supporter of the Global Fund?
A few reasons, Beverly. The first is obviously we care deeply about the fight against HIV and AIDS, TB and malaria. I think specifically with regard to the fund, there are three reasons I'd point to. It's global, and we believe that unless and until the entire world is mobilized, we won't get ahead of any of these three diseases. But if the global community is globalized, we can get there. Second, obviously, it's a fund. It's a fund that puts resources in the hands of people who can bring change on the ground, and that makes a big difference, as we're seeing in the fund's impact across all the all three of these diseases. I think the last thing is that I think a lot of people think of the Global Fund for AIDS, TB, and malaria, and they think of the emergency inherent in responding to these diseases. The fund does that, but the fund is also an agent of change. And through its work, we're seeing a lot of change on the ground with respect to the incidence of these diseases, but also with countries' and communities' ability to step up and manage their health.
How does this advance U.S. foreign policy?
In a lot of ways. We believe that among the other things that are important to our national security is the health of communities and countries. Ill health, whether imposed by an epidemic like HIV and AIDS, or something like malaria, which just eats away, particularly at the poorest in communities, is very high cost. It counters the ability of those communities and countries to develop and become strong and capable partners. And a lot of these diseases, as we know from HIV and AIDS, don't know any borders. And so there's a huge challenge there.
Talk about the fact the U.S. by law cannot contribute more than its contributions can't be more than a third of the contributions to the Global Fund. What about other partners and other funders? How are they responding?
Well, I actually think that's a good law. I mean, that puts us in a position to be very robust leaders in terms of contributions to the fund, but it sends a very, very strong signal that the rest of the world needs to step up. We think it's going very well, and one of the things we've done recently is to structure our own commitment to the fund such that we're laying down a challenge before other countries. And we are seeing a lot of the fund's traditional partners maintain their commitments, and many of them increase their commitments. We're seeing some new countries step up. And significantly, we're seeing some countries that at the beginning of the fight against this epidemic, and particularly HIV and AIDS, were very constrained in what they could actually do, and now they themselves are stepping up to support others through the fund. So we think it's going well, but our very strong message is this: we are prepared to lead, and we will remain the leaders, but part of leading is mobilizing the rest of the world to step up.
The U.S. works bilaterally and multilaterally on all of these issues and all of these issue areas. Looking long term, how does that impact the work that you're doing with the Global Fund, but also with PEPFAR and the President's Malaria Initiative?
Yeah, that's a great question. Through PEPFAR, which is something we're very proud of, we're proud to have inherited it and proud to have been able to build on it. We've seen enormous gains, and these are gains that affect millions of people around the world, and I think convey from the people and government of the United States our commitment to their well-being. The Global Fund, as I say, is another very important tool for us because we can contribute directly and get additional outcomes, but by signaling to the rest of the world that we want to work with you and we'll come in and you need to come in with us, we'd like to believe that we can help generate and leverage more resources for the cause. Those two programs, PEPFAR and PMI, work very closely with the fund, and one of the things that's been terrific to see, particularly over the last few years, is an even deeper coordination between those two. In some cases, that's a division of labor. In other cases, it's a doubling down on a specific target. So we're very proud of a really terrific partnership between PEPFAR and PMI on the one hand and the Global Fund on the other, and think that it has great benefit for people on the ground, but also for us to work through both the bilateral and multilateral sides.
And looking ahead, are there potential challenges that concern you?
Well, I think we've seen such tremendous gains. I would say the biggest challenge is keeping up the momentum on multiple fronts. One, that means that countries need to continue to provide support for this. And again, while we're seeing a lot more countries step up, there's still some countries that need to step up. And we're focused on those. The advocacy community is focused on those. The fund itself is focused on those. So donors need to step up, and donors that haven't stepped up yet need to get there and come with us, because this is a really worthwhile enterprise. I think second, one of the great things we're seeing around the world is more and more countries that are deeply affected by the impact of these three diseases putting more of their own into the game. That means more political capital and leadership. That means more domestic resources. That means more of the kind of domestic diplomacy of talking to their people and communities about the challenge they face. And that's something that's bringing us huge returns. So keeping the momentum up there. And then I think the third thing is that even as we continue to score the gains we're seeing, particularly on malaria and HIV and AIDS, we can never just rest on our laurels, because one of the things we know is that as you make more and more progress, the people who are still out there who need help and support to take control of their own lives are often the poorest, the disenfranchised, the people that some people don't want to talk about or treat or touch. And it's for them that we've got to keep our foot on the pedal and keep going.
Gayle Smith, thank you so much.
Thank you very much.